The practice of bone marrow transplant is really amazing. It's a fabulous way to help families through a very difficult time in their child's life and in their family's life in general. The treatment is quite intense and the medical therapy is very complicated, but you really do get to form tight connections with patients and their families and help them make it through that process and get back to life, enjoying life as they should. One of the things that I'm researching at this time is in collaboration with our comprehensive fertility program at Cincinnati Children's Hospital. We have a program whereby we offer all patients undergoing chemotherapy treatments the opportunity to talk about preserving their fertility if possible prior to their initiation of their treatment, which is wonderful. But we don't really know very much in the pediatric population and the young adult population what the current treatments that we're using do to fertility in the long term for these patients. So one of the projects that I'm working on now in collaboration with folks in gynecology, endocrinology, and urology is a project looking at the pubertal development and fertility of patients after bone marrow transplant, looking at standard high-dose bone marrow transplant as well as the more newer reduced intensity transplant regimens to try to see if there's a difference in how patients do after transplant, so that we can learn better how to help them preserve that aspect of their lives. One of the unique things at Cincinnati in our marrow failure program is that our marrow failure transplanters actually treat patients with bone marrow failure both before, during, and after bone marrow transplant. It's a unique model, and really there's a continuity of care there that allows for treating our families and patients over many years of time. So we're involved in their diagnosis, monitoring their marrow failure disease and helping with the complications of the disease. And then if they need a transplant, we can also be their transplant physician. And that continuity is really fantastic. It allows us to really form a bond and connect with families, and really helps, I think, in the transition during difficult times in the disease process or difficult therapies like bone marrow transplant.